Thanks, Kate. Yeah, for anyone that doesn't know me, I'm Matt. I'm one of the QI coaches. I also just want to really quickly add my thanks to Sheena. As a QI coach, but also as a clinician, I've also seen it twice now, but I agree with Amanda. I think said that it's just so clear and so useful. So thank you for that. So in this session, we are running a few minutes late, but we just wanted to start looking at implementation and what this means for your project teams and what it means for your wards moving forward, because we are getting closer to the end of the collaborative now. So we want to take a look together at sort of how you can continue and maintain the great work that you've been doing so far. We know that you're all at slightly different stages of sort of testing and refining your change ideas, partly because of the interruptions to the collaborative, but it's still useful to start thinking about these things now and how you're going to keep the work alive on your wards when the collaborative ends in September. So if we can go on the next slide, please, Emily. So before we look at sort of the theory of implementation, I just wanted to take a quick look at what you've done so far and maybe what your next steps might be. So this diagram shows the sequence of improvement, and you've all done the first few stages of this, and hopefully we'll continue to do these as QI becomes part of your daily practice on your wards. So looking at the beginning of that cycle, we've developed a theory of change together, which includes an aim, measures, and your change ideas. And you have been testing and refining these change ideas using PDSA cycles. And over the past few months, you've also shared these with the rest of the collaborative at learning sets and workshops, and hopefully maybe stolen a few ideas from other teams and used those on your own wards. But this isn't the end of the collaborative, and this isn't the end of your sort of work on sexual safety. And potentially you have the most challenging bit left, which is to make the changes you've made, and also the kind of the culture and practice of QI part of your normal day-to-day routine on the wards, and hopefully spread that change to other parts of your service. So if you can go to the next slide, please, Emily. So as I said, this session is focusing on implementation, so making your new ways of working part of your normal day-to-day. This is what we mean by implementation. And there are differences between testing ideas, which is what you've been focusing on, and implementing them. And in testing your change ideas, you might feel that they're already part of your normal routine, but how do you know that this is actually the case? And how can you ensure that this is actually what is happening? So if you can just go to the next slide for me, please. Yeah. So while we're thinking about implementation, it might be quite useful to have this question in the back of your mind. And if the leads for this work on your ward were to move to another part of the service somewhere else, how do you think the changes that you've made would continue? If the answer to that question is a relatively confident yes, then you've probably already started the process of implementing your new ways of working on the wards. But for some change ideas and for some of you, the answer might be no, and it might be worth taking some time in the next sort of few weeks, with your wider team and with your QI coach, to maybe think a little bit more about what we're going to talk about today. So if you can just go to the next slide, please. Yeah. So with that in mind, we're going to take a look at the theory of implementation and how this might apply to you and your teams. And then after that, with the time that we have left, there should be some time for any questions or discussion, or maybe for you to share some examples of ways that you've been implementing your change ideas. So on this slide, you can see that there are 6 stages of implementation, and we'll briefly go through them one by one to give you just a bit of an idea of what you might need for each stage. So the first of those is standardization. So this involves establishing some kind of model or guideline so that everyone on your ward that is involved in a new way of working is able to understand what to do and how to do it. And when you're thinking about standardization, it's useful to think about if someone came onto your ward with zero knowledge of your new ways of working, would the way that you standardize it, would they be easily able to replicate that on the ward. The next stage of implementation is documentation. So once you have standardized the procedure, how are you going to document it? And however you do document it, it should be easy to find, easy to share, but also easy to update, because you won't stop doing PDSA cycles, you won't stop learning from changes that you made. And so at some point, you will probably want to update those ways of working as you go along. So the next slide, please. So the next one is measurement. So now that you have your new ways of working, how are you going to know if they continue to work for your ward? So how are you going to continue to measure whether your change idea is leading to an improvement? And similar to the data that you've been collecting throughout this collaborative, there should be real-time data, so measuring over time, so that you can see as you go along any changes in that data and you can react to it if you need to. So the next slide is the fourth stage, staff education training, induction and support, which is probably fairly self-explanatory. But when you're thinking about these things, remember to think about all the different members of your MDT, but also that the needs of your maybe existing regular staff might be different to those of temporary staff, new staff. So it's important to bear that in mind. It's probably also important to bear in mind that when we're thinking about training in particular, standalone training may not always be an effective answer without a way to reinforce that learning. And then if we go to the next slide, please. So the fifth stage is about managing resources and what resources you might need. Again, fairly self-explanatory, but it's the resource that you need will be different for every different change idea, every different kind of new way of working that you want to implement. But it's probably good to start thinking about what you might need in the future now. This will reduce the risk of you sort of slipping back into old ways of working. And then the final stage is socializing the change. So this stage is thinking about how you can maintain engagement across your whole team, including patients and people that use your services. How can you keep the team engaging with QI, coming up with new ideas, testing them and making them part of your daily practice? And I think a lot of you have, this has been a particular hurdle because, we have had frequent, interruptions and lots of other challenges throughout this collaborative. It's also about how are you going to engage members of the team who might be resistant to the work. They might be skeptical, they might have concerns, and also about how might you re-engage the team if they do start to slip back into old ways of working. And then, so the next slide, please. Brilliant. So we haven't had much time today, so we have whizzed through the sort of theory of implementation a little bit, but these slides and the presentation will all be available on our website. I hope it's at least been useful to start you thinking about how you're going to take this work forward on your wards over the next few months of the collaborative, but also once the collaborative ends. I'm going to hand over to Kate for the discussion part of this session, but quickly just wanted to say that we do also have a sort of a handout, a worksheet, which helps you take you through sort of step by step how you might sort of implement some of your change ideas. That will be available on our website. You can also get it from your QI coach, and also any of the QI coaches are happy to talk to you whenever if you do want to sort of talk through and discuss this further outside of the learning set. So that is, I'll hand over to Kate now.